Team 10 presents The Surveillance of Polio.
Polio is a highly infectious disease caused by the polio virus. It defeats the nervous system and can cause total paralysis in a matter of hours. The virus enters an individual's body through the mouth and multiplies in the intestine. Initial symptoms of the virus are fever, fatigue, headache, vomiting, stiffness in the neck, and pain in the limbs. 1 in 200 infections lead to irreversible paralysis, usually in the legs. There's no cure for polio. Polio can only be prevented. Many of the muscles are weakened by polio, as you can see in this picture. The shoulder muscle and arm muscles begin to turn stiff, resulting in the lack of strength to straighten one's arm. Thumb and finger muscles begin to stiffen and stay bent. And last but not least, the muscles that are weakened the most are the leg muscles. Over time, it becomes impossible to bend and straighten one's legs. Once the leg muscles are deteriorated due to the virus, it affects an individual's ability to walk in a normal manner.
The fight to end polio. Polio is 99% of the way to being eradicated. 3 countries have yet to stop polio, which are Nigeria, Afghanistan, and Pakistan. The majority of children that contract this crippling disease are under the age of 5. To reach the final 1% of children is the most difficult because polio still exists in some of the most challenging parts of Africa and South Asia.
In order to cure the polio-endemic countries, there needs to be an improvement in current surveillance efforts. We need to focus on the highest risk areas and countries. One area for improvement is surveillance, which involves collecting and testing water samples from sewage networks, along with educating the citizens of these poor communities.
In most countries, the global effort has expanded capacities to tackle other infectious diseases by building effective surveillance systems. Nationwide, acute flaccid paralysis surveillance is the gold standard for detecting cases of polio. The 4 steps of surveillance are: 1. Finding and reporting children with acute flaccid paralysis. 2. Transporting stool samples for analysis. 3. Isolating and identifying polio in the laboratory. And 4. Mapping the virus to determine the origin of the virus strain.
Here is a global map showing the countries currently still affected by the polio virus. The beige shaded areas are the surrounding countries in the polio endemic region, whereas the red shaded countries are still currently dealing with the virus.
The polio outbreak in Syria could pose a new threat to Europe, according to 2 German infectious disease experts. In a letter written to the medical journal The Lancet, doctors Martin Eichner and Stefan Brockmann warn that the virus may well spread to Europe as thousands of Syrians flee the civil war.
There may be a risk of importing the infection into European settings. And we have been vaccinating here with the inactivated polio vaccine for the last 10, 15 years, depending on the country. And this vaccine is perfect in preventing disease, but it's not completely perfect in preventing the infection of individuals.
The risk is especially high in regions of Europe with low vaccination coverage, such as Bosnia, Ukraine, and Austria.
There are some countries in Europe with a lower protection. Means Austria has, according to the WHO side, approximately 80-85% of IPV vaccination rate. And in the eastern parts of Europe, especially the Ukraine, at only less than 60%.
For many, polio is a disease of the past, a highly infectious virus that attacks the nervous system. In many countries, polio has been virtually eradicated by mandatory vaccination programs, and Syria was one of them. The last time polio was detected in Syria was more than a decade ago, in 1999. But now the World Health Organization has confirmed at least 10 cases of polio inside Syria. Experts say because only 1 in 200 people infected develops paralysis, the virus can spread silently for months before an outbreak is detected.
We have to make sure that the refugees coming to Europe are vaccinated, polio and for other diseases like measles and so on.
UNICEF and the WHO have announced the largest ever united immunization response in the Middle East, aiming to vaccinate about 20 million children in 7 countries and territories. But with so many people fleeing the violence in Syria, and with so much of the country inaccessible because of the fighting, there is concern that the nightmare disease could endanger several regions of the world. Atika Schubert, CNN, London.
Ways to eradicate polio in these few countries would be to get the 4-step surveillance program started. With this program being started in these third world countries, it will educate citizens and their communities. These poor communities will be able to be funded through charities, donations, and help through mission trips. Once these populations have been funded, children will be able to get the vaccines they truly need.
The only way these third world countries will receive the vaccines they need is through being assisted with funding. There are many ways to go about funding, whether it be through starting charities, sponsors, donations, or help through mission trips. The Bill and Melinda Gates Foundation is a prime example of how sponsors and charity foundations can help these countries stop the spread of epidemics throughout their living environments. In order to eradicate polio in the endemic countries, there needs to be an improvement in current surveillance efforts. We need to focus on the highest risk areas and countries. Most high-risk countries are rural, poverty-ridden, and lack an efficient healthcare system. The only ways we will be able to cure those polio-stricken people in these countries are through assisting them with sufficient funds. One area for improvement is surveillance, which involves collecting and testing water samples from sewage networks in these non-hygienic communities. Also, we must educate the citizens of these poor communities on ways to protect themselves from the polio virus, whether that is teaching about the importance of vaccines, proper hygiene, and overall the awareness of prevention.